A fresh breeze is blowing through Kenya's health sector, and at the center of it, a familiar face with a reputation for calm in the storm. You remember her from those daily COVID briefings, right? Dr. Mwangangi, the poised and passionate health leader who stood beside Kenyans during the toughest of times, is now back in the spotlight. And this time, she's leading the charge. Dr. Mwangangi has officially been appointed the new Chief Executive Officer of the Social Health Authority, SHA. This is the body that has been tasked with a huge mission, steering Kenya's health insurance system into a brand new era. And with this bold move, the government is making a statement. It wants results, and it's putting experienced hands on the wheel. Now let's break it down. SHA is not just another name. It's the engine behind the new Social Health Insurance Fund, NHIF, which is replacing the long-standing NHIF. Yes, the change is big. The stakes are even bigger. This isn't just about changing names or logos. It's about changing how every Kenyan accesses healthcare. So who better to lead this charge than someone who has already walked through fire? Dr. Mwangangi rose to national prominence during the COVID-19 pandemic. She was that reassuring face on our screens, explaining tough realities with clarity and always pushing for better care, more access, and stronger health systems. And she's not just a public figure, she's a serious professional. Dr. Mwangangi holds a master's in health economics from the University of Adelaide, and she's held key roles in government and at AMREF Health Africa, where she focused on health systems strengthening. Her appointment wasn't handed to her either. She was picked through a rigorous process. 12 candidates made it to the shortlist out of 92. Interviews were held in early April 2025, and sources close to the process say she impressed the panel with both vision and substance. Now she's stepping in at a critical time. The SHA is expected to lead a full-scale transition from NHIF to SHIF. The idea is simple: make healthcare more affordable, more fair, and more available to every Kenyan, whether you live in the city or deep in the countryside. But this won't be easy. There are structural challenges, funding questions, and trust issues with the public. People want to know, will SHIF really be better? Will it be free from the problems that plagued NHIF? And that's where Dr. Mwangangi's real test begins. She's got the brains, the background, and now the badge. But turning vision into reality, that takes grit, that takes diplomacy, and most of all, it takes the trust of the people. I've watched Dr. Mwangangi's journey with admiration. She's smart, no doubt. But what has always stood out to me is her ability to listen. She doesn't just speak policy, she speaks human. That's rare in leadership. But now the pressure is real. The expectations are sky high. This isn't just about managing a fund. It's about rebuilding public confidence in healthcare itself. Dr. Mwangangi, if you are listening, we believe in your track record. But this time, don't just guide the system, transform it. Let Kenyans feel the change, not in paperwork, but in hospitals, in clinics, in their homes. We'll be watching, we'll be hoping, and we'll be holding you to account. That's your health update.